College of Nursing. Today we are gathered here to present the case on hypertension. My kids are went to that Kalpana hospital and they may experience many cases. Among that cases, they are going to present on hypertension. Yes, you can proceed.
Good morning. When I went to Kalpana hospital, I met a patient with hypertension. His name was Rajan. He was 47 years old male. He had the chief complaint of dizziness and blood pressure. After the investigations like measuring BP, the doctor diagnosed as hypertension.
What kind of hypertension he have?
Hereditary hypertension.
Whether their parents are diagnosed as a hypertension?
He had the history of hypertension.
Oh, they are also hypertensive.
Yes, ma'am.
Okay.
The hypertension is meant by the increased blood pressure. It is the force that apply in the walls of artery as blood and cardiac arrest.
Yeah.
There are some types of hypertension. The first one is primary hypertension. It is due to no cause. It can be by family history or prolonged mental tension. The second one is secondary hypertension. It is due to pathological conditions. The third one is borderline hypertension. It is due to the intermittent elevation of blood pressure. There are some signs and symptoms for hypertension. My patient Rajan had the signs of blood vision and dizziness. The other types are hematuria, epistatis, proteinuria and all. The diagnostic evaluation can be done by measuring BP, and there are some other sources: physical examination, history collection, the chest X-ray. The complications are stroke, cardiac arrest, etc. The nursing management can be done by elevating the position into forward position to relieve from dyspnea and regular checking of BP, giving proper medications. What is blood pressure?
Increase the blood pressure. What is the normal value of blood pressure?
Systole is 120 and diastole is 80.
80. You have to always say units. Mm per hydrogen. Okay. Yes.
The types of hypertension.
Primary hypertension, secondary hypertension.
Can you
So
tell me the
this
symptoms?
client is having a primary hypertension, right? Because he is, I heard his parents also is having. They are also diagnosed as a hypertension. So he is diagnosed as a primary hypertension, right? Yes.
The signs and symptoms of hypertension.
Polyuria, dizziness, high pressure, breathlessness.
What is proteinuria? He said no. What is proteinuria?
Increased urination.
No. Presence of protein in the urine. If we are not controlling, they are going for the next stage like renal failure. Okay. So in the initial period itself, have to do all the investigation, and as a nursing team or a health professional, we can be able to control those cases, especially in case of hypertension. Okay. We can control the protein. That is, protein is passing from the body through the urine. That is proteinuria. Okay. Yes. Then do you know that World Hypertensive Day, when we are celebrating World Hypertensive Day, any idea? No. So that month, that day was gone. That is, every year, May 17th, we are celebrating World Hypertensive Day. Do you know that theme of the day? Any idea? So what is the last year theme? You have to check your blood pressure accurately. So each and every person, not only the hypertensive client, even a normal person, you have to check your blood pressure in an accurate way, and you have to control it, and you have to live long. That is theme of last year. What is the theme? Check blood pressure accurately, then you have to control it, and finally you have to live long. This is the theme of last year hypertensive day. So when we are celebrating? Every year 17th of May. Okay. Then are you heard about the DASH diet? DASH full form. DASH diet, especially for a hypertensive client. dash diet means dietary approach to stop hypertension. What? Dietary approach to stop hypertension. They are given some of the recommendation under the dash diet. That is, if they are a hypertensive client, they should not take 5 grams of salt per day. Per day, they have to control their salt requirement within 5 grams, not more than that. That is one recommendation. And they have to take all green leafy vegetables in an adequate manner in a day. And they must avoid all the junk foods. Okay. Can you give some examples for junk foods?
KFC.
Yes. So all the baked items and roasted in the oil, that are the junk foods. They must avoid that junk foods. That is, they have to avoid junk foods and also preservative foods like pickle, dry fish and all. Why? In those food items, salt is preserved and it will increase the level of blood pressure. Okay. So, and one more thing, they must avoid of taking alcohol and tobacco smoking. This also they have to avoid. So, these are the recommendations are given under dash diet. So, what are the recommendations? You have to tell one point.
Avoid junk foods.
Avoid junk foods. Then,
Avoid high salt.
yeah, high salty food they must avoid, like dry fish and pickle. Yes. What is the full form of dash? Yeah, diet. Very good. Dietary approach to stop hypertension. Okay. So, what about the salt requirement per day? How much they can able to take per day?
5.
Yeah, very good. 5 grams per day, not more than that. This is the dash diet and their recommendation. When we are celebrating World Hypertensive Day? Very good. May 17. What is the theme?
Check to
One at a time. Check
blood pressure accurately.
Yes. Then control it. Third, live long. So you have to check your blood pressure accurately. If you are having high blood pressure, you have to control it. So based on that, you have to live long days or long year. Okay. Have you got it?
Yes, ma'am.
Everyone?
Yes, ma'am.
Any doubt?
No, ma'am.
No. Okay. With that, we are concluding our case presentation. Thank you all.
Thank you.